Hello, I'm Dr. Mang, and this is Dr. Garner, and today we're talking about the respiratory system.
Well, the main question is, what is the respiratory system? And we have Dr. Mang to tell us right now.
Your respiratory system is made up of the organs in your body that help you breathe. Respiration equals breathing. The goal of respiration is to deliver oxygen to the body and take away carbon dioxide.
There's many different parts of the respiratory system, and to get a better knowledge, we have our guest, Tristan Wright, will show us. There you go, right there.
Tristan Wright.
Okay.
I love your show, guys.
Glad to have you.
It's good to have you here.
Okay, well, first, the lungs. That is right here, protected by the ribs. Next, we have the trachea, right in the throat there. And connected to the trachea at the bottom, right here, we have the bronchi. Next, we have the diaphragm, which is just below the lungs. It tickles. And Dr. Mang,
Yes.
take it away.
All right. The lungs are the main organs of the respiratory system. In the lungs, oxygen is taken into the body and carbon dioxide is breathed out. The red blood cells are responsible for picking up the oxygen in the lungs and carrying the oxygen to all the body cells that need it. After that, the red blood cells are controlling.
Okay.
Red blood. Yeah.
Just continue. You're just having trouble breathing a little.
Would
He's had a tough day.
you tell us about the trachea, Dr. Garner?
Yes, of course, as you know where it is. It's also sometimes called the windpipe, and the trachea filters the air we breathe and branches into the bronchi. And the bronchi are two air tubes that branch off at the trachea and carry air directly into the lungs. Now, Dr. Mang, could you tell us about the diaphragm?
All right. The diaphragm is a dome-shaped muscle at the bottom of the lungs. When you breathe in, the diaphragm contracts.
Of course.
And when you breathe out, it expands, yes. Forcing the air out.
Okay. You know, now we have had a couple questions sent in from our viewer audience, and one of them is, why do I yawn? Dr. Mang, would you like to answer that question for us?
To answer that. When you're sleepy or drowsy, you usually don't get enough oxygen, and so the brain responds by taking in a very deep breath, which we call a yawn. Another question is, why do I sneeze? Would you have to tell us about that?
Yes, well, sneezing, it's like a cough in the upper breathing passages. It is the body's way of removing an irritant from the sensitive mucous membranes of the nose. Many things can irritate the mucous membranes. Dust, pollen, pepper, or even a cold blast of air are just some of the many things that may cause you to sneeze. And our last question from our audience is, what causes hiccups?
Alright, this is a common question. Hiccups are sudden movements of the diaphragm. They're involuntary and you have no control over them. There are many causes to hiccups. Sometimes the diaphragm may get irritated, you may have eaten too fast, or there might be some substance in the blood that could have brought on the hiccups.
And I hope this video has helped you learn about the respiratory system. Dr. Mang,
Dr. Garner.
see you next time.